So those are my two things. Thank you so much. I'll stop talking too much.
Well, thank you. Those are great questions. And let me start with the second part first, which is how do we balance out the use of parks and beaches for our community, especially for people who may not have immediate access, who don't live at the beach, who can't just walk to the ocean. And we recognize that there's a big equity question here. That, for example, in Watsonville, there's very few parks per capita and very little outdoor space. And so this is much more of a hardship for that community than it is perhaps for Mid-County, where it's easier to get to the road to walk along the ocean and at least get to breathe some ocean air, even if the beaches and parks are closed. So we recognize that there are inequities in this decision. And that was one of the big hesitations that I had and that our leadership had in making this tough decision. So I think back to your first part of the question, which was what can people do to promote their physical and mental health this coming next week while the parks and beaches are closed. And I want to remind people that they can still get outdoors and still spend time with their household members, their loved ones, and people that they live with in their own yards, if they are lucky enough to have those. And they can certainly walk on our public streets and public sidewalks, maintaining social distance or physical distance, at least 6 feet from your non-household contacts. You're free to walk closely with the people that you live with because it's assumed that you're sharing germs with them anyway, that you're close enough with them. So I definitely encourage people to get out and walk and move around their neighborhoods and their own yards if they have yards. And then secondly, I'd like to say that social distancing, we hope, does not incorporate all social disconnection. We're trying to make the point that what we're really talking about is physical distancing, is that people who don't live together should do their very best when they're out of their homes to stay at least 6 feet apart. And that's because we know that this virus is spread by droplets, and it's so coughs and sneezes and the droplets that we all spray when we speak to each other. But it's pretty hard for those droplets to travel as far as 6 feet. And so as long as you're staying apart 6 feet, it's safe to be outside with other people. And if you choose to wear face coverings, there's some evidence that perhaps increases or decreases the risk of you infecting other people if you don't know that you're sick, but you might be shedding virus. So that's something else you can do to protect others around you. And then, you asked for 3 things that people could do for their physical and mental health. And I think it's important to remember that even though it feels like there's not a lot to do, it's better not to sit in front of the TV all day long and to try to do something other for your brain other than TV and screen time. So I'd say reading, great time to make some art or make some music or do things that you might otherwise not do on your off days.
Great. Thank you for sharing that, Dr. Newel. Why don't we go to our next question? Remember to tell us your name before you ask your question.
Hello?
Hello, you're on.
Hello? Hi, I'm Patricia Marland. My question is SoCal Demonstration State Forest also supposed to be closed? I know it's not noticed as a park, but it has many bike trails, and Highland Way is experiencing continual flow of trucks laden with bicycles to the bicycle park, and these bicycles come from all over the Bay Area. There's emergency vehicles that are called because there's often accidents in the park. Even this weekend, emergency vehicles are taken away from from the virus. So my question is SoCal Demonstration State Forest supposed to be closed?
Thank you. Dr. Newel, do you know the answer to that?
I do not.
The state parks have also closed, and so we can check about the demonstration forest. I know that that's a very popular mountain bike run, and I'll post the answer on my Facebook page to let you know what's going on around that. And if you're not on Facebook, just send me an email to the office, and we'll answer you there as well. Anybody that we don't get to this evening, we will, if we don't get to your question tonight, you can also email us, and we'll work very hard to get all your questions answered. So could we have the next question?
Hello?
Hello, you're on.
Oh, hi. My name is Alice Frank, and I'd like to know what is the availability of testing here in the county? How many tests does Santa Cruz County have, and how are they distributed to healthcare facilities?
Yes, I can give you some of that information. First of all, I want to tell everyone that just in the last hour, our updated data dashboard is posted on our county website, and you can find it at santacruzhealth.org/coronavirus. Or if you just go to santacruzhealth.org, you can find your way there. And one of the new data points that's on there is the total number of negative lab test results. And I'm going to explain that to you here. As of today, when this dashboard was created, the total number of negative lab test results was 1,469. And so if you add that to our positive test results of 76, you get a total of somewhere over 1,500 tests that we know have been done in Santa Cruz County. Now, we don't know the number of tests that have been performed that we don't have results on yet. So if a test is done and it's done anywhere outside of the public health lab system, we have no way of knowing if it's been done until the result comes in. So it may be that there's 1,000 more or more tests done out there in the last week or 2 weeks, and the results are still pending. So because most labs now are being done at commercial labs, like Quest or LabCorp, we don't know when those have been performed. So I do know that testing capacity has greatly increased. So even just a matter of 3 weeks ago, our only option for testing was through our public health lab, which is in Santa Clara County, and they are only able to do about 60 tests per day for all of Santa Clara County and Santa Cruz County. And so we only have been sending them tests on patients who are hospitalized or patients that are known to be a close case contact that we're doing a case investigation on. So we have sent them somewhere around 120 lab tests, and all the rest of them have been done in commercial testing labs. I do know that Dominican Hospital is expecting to start testing next week. The Dignity Health System was able to get some point-of-care testing equipment, and they're hoping to start next week as well, where they can actually give you the results in the same time as your office visit. Our public health clinic Our health clinic on the Emmeline campus here also will be starting to test next week. So we will have local testing capacity shortly, and numerous commercial labs are testing as well, as I mentioned before.
Thank you, Dr. Newel. I want to remind people that if you want to ask a question, you hit star 41, and that raises your hand. And if someone asks the question you were going to ask, you can hit star 42, and that lowers your hand. So I think we're ready for the next question. Be sure to give us your name. Hello.
Hello. Can you hear me?
Yeah, we can hear you.
Hi, my name is Jerry. I live in SoCal, and thank you for doing this stuff. And my question has to do with the future of where we're heading. It's way too much to talk about a day when we would relax measures that are being taken right now to mitigate this pandemic. However, I would hope that discussions being had about the criteria that should be used to determine when we could safely begin to relax measures. And specifically, I was wondering if discussions being held around antibody testing, follow-up people who are positively tested for coronavirus in terms of their contact, and then what statistics would you be looking at to determine that a long enough period has elapsed over which you see a decline in whatever number you think is most important indicating it's heading towards recovery from this pandemic? Thank you.
Okay, Jerry, it's a little hard to make out everything that you said. I think that you asked, how do we determine who gets tested, and how do we know when we get to a place that will be on? You didn't put it like this, but on when it's safe to go out and it'll be safe to resume activity.
Yeah, I think that's what I heard too. But it was a little bit hard to hear. So, yeah, great questions. And we're watching our modeling and our curve very closely on our cumulative cases. And if you go to the website that I mentioned, you'll be able to see some of that modeling right in front of your eyes. So we're tracking cases, and we're tracking the curve of our doubling time of the number of cases. The usual course of disease is a steep upward climb when the disease starts to really take hold and spread through the community, a peak time of cases, and then a downward curve. And so when we talk about the flattening the curve, what we're hoping to do, we're hoping to make the actual curve flatter but also last longer. So the more successful we are at flattening the curve, the longer this is going to last. And that may sound like bad news, but if we can keep the curve flat, then we're going to lose fewer people, fewer deaths, fewer hospitalizations, and less chance that we're going to overwhelm the healthcare system with needed hospitalizations and ventilators and that kind of thing. So what we're going to look for is when that curve starts, well, we haven't seen the peak yet. We haven't even really seen an acceleration. So once we see an acceleration and then either a peak or a shoulder, we'll be watching that. And when our cases start to go down the other side, then we know that we can slowly start to lift some of our restrictions, and a little bit at a time, and assuming that the curve continues to trend down, then we'll be lifting more and more of those with time. Now, what's anticipated is perhaps in the Bay Area, because we've been pretty successful throughout the region in flattening the curve, we might not have a big curve up and then drop. We might have a whole series of little bumps instead, which is better for the healthcare systems and fewer deaths and fewer impact on all of us. But this may be literally and figuratively a bumpy road for a while ahead. We're going to learn a lot from we're going to learn a lot from watching what's happening globally. So, for example, Wuhan has just opened its borders the last couple of days, and it's to allow people to leave and come into the province, Hubei province. And so it will be interesting to see what happens there as they allow more movement.
Thank you, Dr. Newel. I want to ask people that when they ask questions that they don't use their speakerphone, that they try to pick up their phone. I think we'll probably hear you better, and that way we'll answer the questions that you ask rather than the questions we think you ask. If you could turn on the next caller, Dave, that would be great.
Hello.
Hello.
Hi, my name is Abby. I live here close to downtown in Santa Cruz. I hear a lot of talk surrounding social distancing as our main technique for, quote-unquote, flattening this curve, and a lot of talk about flattening the curve. My question is, what other techniques can we start employing to mitigate this or address the issue? That's part of my one question. I know during the 60s, during the tuberculosis outbreak, there was a lot of stuff done about searching and identifying hot spots, putting up UV lighting, mass testing for even people who, they went door to door, as I was reading. Because as we've been told, there's a lot of people who can be asymptomatic with this COVID-19 and potentially not know it. And I just think that if you could test everybody, if you could do mass testing, we could start doing some more isolation, finding the hot spots, figuring out how to slowly move forward, utilizing some of those techniques. And I know that rapid test, I think, which is what the test that Dr. Newel was talking about, that rapid test, is that what's going to be at the clinics? And can everybody, I am late 30s. I'm assuming, just based on everything I've read, that I might even get a cold. Maybe the cold I had last week was it, and I don't know, I need to know, whether I'm hurting people, whether maybe, and also it would help us with if people had the antibodies. The other thing I was reading about was the plasma of people who have had it. Then if you could identify people, who were, asymptomatic carriers who may have antibodies. I can't remember the name of the plasma thing, but Dr. Brilliant did a KQED thing that I listened to. So I'm kind of I want to implement. I want to see my leaders implement the things that Dr. Brilliant was talking about.
Abby, I want to make sure we get to answer as many questions as possible. So I want to make sure to answer your question, and so I want to
that's it.
make sure they're brief. I'm sorry, Dr. Newel, did you get all that?
Yeah. So thank you, Abby, and what we do in public health, so much of it is communicable disease control, and we have a whole team of people who, even when COVID isn't happening, who do disease investigation, and they're experts at this. We have a team of epidemiologists who help us track exactly where the disease is and how it's moving and how we can control it. And then we have teams of nurses who do follow-up testing, and they actually contact each person. And you bring up, a great history in public health around tuberculosis. And tuberculosis, as you know, though, is quite different from coronavirus. And you can test tuberculosis and find out if a person's ever been exposed in their whole life and if they're currently exposed or currently suffering from the disease. With the coronavirus testing, that can change every day. So a person could test negative one day, and unless we tested the next day, we might not know that they're an asymptomatic carrier. But you're right in that we could do surveillance within populations to get a much better idea of how prevalent the disease is and where it's spreading. Right now we're focusing our efforts around, because we have limited testing, we're focusing on congregate living settings, so where people live closely together, because as I'm sure you've seen in the news, the big tragedies that are happening are in their skilled nursing facilities, also in any detention facilities, so our jails, our juvenile halls. Not here in Santa Cruz yet. We haven't had anything like that, but those are the most likely places that will have outbreaks, which will then spread into the community. So we're focusing our efforts on our nursing homes, our residential care facilities, our migrant housing, our jails, to try to nip those kind of outbreaks in the bud. And then as far as antibody testing, we're very excited that we'll be able to offer that soon in our community to be sent to labs that are providing that. However, the caveat is that we don't know how to interpret those tests yet. We don't know if seeing the IgG or IgM antibodies, what kind of immunity that even indicates. And we know from China that some people who had the virus just as soon as 2 weeks later got it again. And so we don't know who's immune and for how long. So more to come.
More to come. So remember star 41 if you want to ask a question, star 42 if your question got asked. We're ready for the next call. Hello?
Oh, yes. Hi. Can you hear me?
Hi, we can hear you now.
Okay, great. My name's Maya. So I have a pretty simple question about PPE and E, because some of my nurse friends have said that they're reusing the same surgical mask for days on end. I find that pretty horrifying, especially since we've been hearing about this since January. But so my question is, how many masks does the county have in inventory on January 1st, and how much money, just ballpark, is okay, did the county spend on masks from then until the shelter-in-place order in mid-March?
In early January, we had a cache of N95 masks. So the only masks that the county had were the masks called N95s. And every county and the state and the federal government all had a cache of those. The reason that we had those was pan flu epidemics or epidemics like this were part of that, but it was also for wildfire, for smoke inhalation prevention, and also for any kind of bioterrorism events. So that's why all the different government entities had those. So at the beginning of January, we had about 20,000 unexpired N95 masks. And in addition, we had another 40,000 plus expired N95s. Now, those expired N95s were not approved for use by Cal OSHA for occupational settings, but we decided to keep ours in case there was an emergency where they might be needed. And I'm so glad that we did, because we need them now, and they have been tested by the federal government, and there was only one brand and one model of that brand that needed to be discarded as unusable, and the rest all proved safe for use. And so all 60,000 plus of those N95 masks have either now been distributed, or a small number of them have been kept in reserve for our nursing homes for when they do experience outbreaks. So 15% of our total cash has been kept back on our Emmeline campus specifically for our congregate living settings, so the nursing homes, the jail, the juvenile hall, any kind of residential care facilities that are having an outbreak. But otherwise, all of our county cash has been distributed. There have been additional. Yeah, there have been additional donations given to the county. So I believe that Facebook gave $14,000 and the state sent another $20,000. Those have already all been distributed. The county has not purchased more because there are none available to be purchased.
And Dr. Nolan, the 200 million masks that the governor talked about, will we get some portion of those masks?
We already got 20,000 of those from the state, and we certainly hope that. I mean, we have resource requests in for more as the state gets them.
Great. Thank you for answering that question. We're ready for the next question. Hello.
Hello, can you hear me?
Yes. Good evening.
Hi, my name is Josie Roberto, and I wanted to thank you both for doing this town hall meeting. It's been very informative. And my question is, what are you doing to track the COVID patients that have already been diagnosed? Because today, my friend in the East Bay, who has had that illness with her husband, posted that they had called the CDPH to get retested to make sure they wouldn't reinfect anyone and they could go off isolation, and they said they won't do that. So there's been no tracking, at least for them, and it's just basically an honor system that you kind of, go by the CDC recommendations and hope you're not reinfecting people. So I just wanted to see what Santa Cruz County is doing for that.
Yeah, we don't have as many cases as the East Bay counties do, so at this point we've still been able to track all of our cases on an individual basis. So to date we've had 76 cases, and those we've been able to follow each one of those to do case investigations to determine how and where they got their disease in some cases. And we've been able to follow up with all of their close contacts and arrange for testing for all of their close contacts. And in those cases, too, then employers are notified if the person's been at work or a school setting or other settings. We notify those kinds of places as well. You are correct, however, that in most cases we're not doing testing for follow-up, because that requires daily testing until there's 2 negative specimens, and we just don't have that kind of testing capacity through our public health labs. If we did it through commercial labs, we have a turnaround time of 1 to 2 weeks, and so that doesn't make sense if we're trying to determine when someone is clear. So what we're doing is we're using the CDC definition of recovered, which is the person needs to be completely afebrile, so no fevers, without any fever-reducing medicine for a full 72 hours, and they need to be back to baseline on their respiratory symptoms, so like cough or shortness of breath. They need to be back to their usual, because some people have a chronic cough. And then it has to be at least 7 days since their first symptoms started. Now, there are exceptions to this, so certain kinds of patients, like immune-compromised patients, so whether it's because they're on chemotherapy or they have HIV or some kind of medical condition where their immune system is not working, those patients need to be cleared with daily testing.
Thank you for answering that question. We have about a little less than 10 minutes, and we'll hopefully get to most people. And if we don't get to everyone, you can still send in your questions to me, and we'll work to get them answered. Why don't you give us the next questionnaire?
Savannah Ross. The
Hello?
number Susanna Roth.
Susanna Roth.
Hi. Yes, I'm Don Roth. I have one question. Who has the ultimate authority to open the country for business? Trump, Gavin Newsom, the county? How does that work? I'm afraid Trump is going to try and open everything up too soon, and we're going to be back in trouble again.
Well, I think the good news is that the local authority, I want to use the word Trump, but local orders overrule state orders, which overrule federal orders in these kind of situations. So the federal government sets a baseline, the state can make it tighter but not looser, and then the local government can make it tighter but not looser.
One of the few things we have control over. Yeah. All right, we're ready for another question then.
Joseph Panero?
Yes, hello.
Hello.
Hello. What's your question? Joe? Hello? We had him there for a moment.
Yeah, he's unmuted, but Joe? All right, well...
Why don't you mute him again and we'll go to somebody else because maybe he hit his own mute button.
Yeah.
Is there another question?
Wireless caller?
Hello?
Hello, do you hear me?
Hello,
do you hear me? Oh, yes.
Yeah,
Hi, this is Bob Morgan. Thank you for your show today. It's been excellent. And I'm on the website, and the new portal looks really terrific. Thank you for all this great information. I absolutely am in agreement with the closure of the beaches. I am lucky enough to walk near to Pleasure Point, East Cliff Drive, and I do notice many, many people still in the water, even today, and as well as on the beaches. So I hope that that does get enforced. I have two questions. One is, what would make you determine that the beaches remain closed? We have so many people coming from over the hill in Santa Clara to the beaches. And then secondly, you mentioned a lot of vulnerable populations that you're focusing on. How are you focusing on the homeless population, and how is that population being served? Thank you.
Oh, thank you so much for reminding me. That is the unsheltered or the persons experiencing homelessness. That population should have been included in my list of congregate settings, and we're partnering with the Human Services Department, so social services, to develop an extensive housing sheltering model during this pandemic for the unhoused, and it's already underway. We have a motel in the Beach Flats area where we're beginning to house the elder homeless as well as those who are medically fragile, and there's federal money that's covering this. So we're going to fill up one motel at a time. We have contracts with several. And eventually so far we have no COVID positive patients in the homeless population, thank goodness. But when we do, and we anticipate we will be providing them with hotel rooms with social services, including meals and laundry and on-site support and security and medical care in addition. And as long as they don't need hospitalization, they will be able to recover from their illness there. We'll also be quarantining their close contacts in hoteling situations as well. You probably know that the vets halls in both Santa Cruz and Watsonville have opened, and so we're trying to get as many folks sheltered as we can. And our communicable disease teams and epidemiology teams will be working closely with that population as well to immediately address any outbreaks that we identify. So thank you for reminding me to bring that forward as well. And
he also
just a
asked
reminder
about,
that the 7-day closure of the beaches and parks doesn't start until midnight tonight. So today was still fair game for the surfers and beachgoers.
Great. We have time for a couple more questions. We're ready for the next caller.
This is Jeff Lundo.
Hi, Jeff.
I'm interested in. We have two homes, one in Sacramento and one in Santa Cruz. They are not rental homes. Are we prohibited from using our home in Santa Cruz?
No, you're not. The governor's ruling was that people with more than one resident could use both. However, as much as possible, we ask that travel be limited because anytime you go into a new community, you're potentially taking the virus from one community to the other. And our first initial cases were all brought into Santa Cruz by people from out of the area, and we really want to limit that as much as possible. So it's not prohibited, but discouraged.
I would add that we've also tried to step up our enforcement of vacation rentals to make sure that they're only used in limited ways for traveling healthcare or public safety professionals or for families who are meeting the medical needs of a family member here in Santa Cruz. We have time for one or two more questions. Dave, if you could turn on the next caller.
Judy Murillo.
Yes, hello. Supervisor Leopold,
Hi.
Dr. Newell, thanks for hosting this tonight. Part of your rationale for closing the beaches and restricting the outdoor activities, you mentioned that there was fear of people coming over from spring break. Can we get your commitment tonight that you will reopen or lessen the restrictions after the spring break period?
My intention is to keep this to 7 days. I feel strongly about equity issues and issues of mental health with access to the outdoors. And unless I get huge pushback from law enforcement and community members, my intention is to open in a week. I do want to add that, I do want to add that there's a couple of areas that have continued to be problems within our community that I didn't restrict, that I might choose to restrict, and that is skate parks and dog parks, both of which have continued to attract crowds. And those are two areas that I might reconsider closing on a longer-term basis unless people can do their social distancing.
And you would probably keep playground equipment also off limits.
Playground equipment's off limits, and unfortunately that's because our kids get their body secretions all over those playground equipment, and it's really impossible to clean and disinfect between uses.
Sure. All right, we have time for maybe one more question.
Terry Jacinto?
Hi, good evening.
Christopher Lockhead. Am I with you?
Yes.
Yeah, you're on. Hello.
Hello.
We're ready for your question. Dave, is he unmuted?
Sorry, hold on. Let's try that again. Here he goes. Sorry about that.
With you, sir?
Yes, we can hear you now.
You're ready.
Yeah.
Okay, hi, it's Christopher Lockhead. I want to thank you for this call. Thank you both for your leadership, particularly on shutting us down quickly. And I deeply appreciate your action regarding the beaches this Easter weekend. My question centers on sort of our preparedness for any kind of a surge. Are you able to give us any visibility into what you see in terms of a surge taking place here, what our needs might be,
and what we're doing to build capacity in the event that there's a big stress on our medical system. And if you can give us any specificity around that, I would appreciate it.
I can, and I'm prepared with all kinds of data, and I know we're short on time here, but first off, I want to say that overall in California, the surge has been anticipated to occur as early as next week, even this week in some projections. I think April 14th is the most recent peak in California cases that's been predicted. But because of our success and Bay Area success, we think that it's going to be quite a bit later in Santa Cruz, perhaps the first week of May. And as I mentioned earlier, it may be a series of small bumps in the road instead of one big up and down curve. What we're seeing for best case and worst case scenarios varies widely because we really don't have enough cases yet to make great predictions. But where we think the line lands is that we're still going to be okay in terms of our capacity with hospital beds and with ventilators, and that's assuming that folks continue to follow the shelter-in-place guidelines well. I can tell you that currently our two bigger hospitals have a bed count of 250, but they have the ability to expand, assuming there's staff, up to 456 beds. And the state and federal government have loosened many of the staffing restrictions and licensing restrictions to allow staffing to take place. So we're working closely with our hospital partners to ensure that they can staff and equip all of those beds. So we can almost double our bed number. In addition, we've done a ventilator and ICU capacity survey, and we believe that we are capable of doubling our ventilator and ICU capacity as well. So instead of a current capacity of around 25 ICU beds with ventilators, we could go as high as 50. In addition, we've opened 2 alternate care sites. One is at 1440 Multiversity, which is currently set up for 45 patients, but could be expanded to 60 to 80 total. And then in addition, we have an alternate care site at Simpkins Center, the swim center, and that's currently set up for 20, but could potentially be as high as 40 there as well. So we could expand another 100 beds for lower acuity hospital level needs. And then that doesn't count the hoteling options for ill people who are not ill enough to need hospital care, but still need some kind of medical attention, and that would be done in the hotel setting or motel setting. So I hope that offers some reassurance and some answers to your questions.
I'm going to stop taking questions now. If you still have your hand up and you want a question answered, please email me, and we'll try to work to get those answered. I want to give my appreciation to Dr. Gail Newel for her work as our health officer every day, but in the last couple of months and in the last couple of weeks have shown the real mettle of being a great leader, and I appreciate all the work that you put into this and the work of your staff. I think the community is well served by you. I also want to appreciate people listening over the next hour. I'll be back next week with a telephone town hall, and I'll put as soon as I lock down the exact person that I'll have, I'll put it in the newsletter on Monday or on Facebook beforehand. I want to thank you for being here tonight, and if everybody works together, we can get to the other side of this pandemic and be a healthier community. Thanks a lot. Good night.